Hi everybody, this is Dr. A. In this video, I want to go through how to solve case studies. Can be for clinical chemistry, but it really is applicable to any discipline in the clinical lab or even outside of the clinical lab. So let's start here. Well, every case study usually starts with a case presentation. So a typical case study will have a narrative about the patient. It usually includes the presenting signs and symptoms, the medical history, maybe some assessments like vital signs, and usually an initial set of test results, and those can be lab and or medical imaging. So I feel it's helpful if you have it printed, or if you can, in your book, if you want to highlight all the abnormal lab results, especially if they're presented in a table format with a lot of data. So if you have like all your chemistry results or all your hematology results or whatever, and it's like a big old table, it's just nice to highlight them, or maybe you can note them separately on a piece of paper. Okay, so let's then proceed logically. So we're going to start with pieces of the case presentation. So usually they'll give you at least a patient's age or age range, and this can be important because certain conditions will typically affect specific age ranges. So, for example, RSV, respiratory syncytial virus, occurs mostly in infants and toddlers that are age 2 years and younger. So that wouldn't be a likely diagnosis for, somebody that's an adult, for example. Meningococcal meningitis affects teenagers and college-age young adults more than anyone else. But for example, anyone could get the flu, although it affects the very young and the very old more severely. Another example would be type 1 diabetes is more likely to occur in children or teenagers, whereas type 2 diabetes is more likely to occur in older adults. Unfortunately, because of our lifestyle in the U.S. and even outside of the U.S., we are seeing younger people. So we are seeing type 2 diabetes in children and teenagers, which about 20, 30 years ago, that used to not be the case. Cancer can happen to anyone at any age, but the chances of having it will increase once we are 60 years or older. All right, so note the patient's gender. So we're referring to biological gender as genetically male or female. This can be important because certain conditions can disproportionately affect a specific gender. For example, women will experience autoimmune conditions at double the rate of men, but boys are more likely to inherit hemophilia, for example. Men are more prone to heart disease than women until women reach menopause, and then their risk becomes similar. So, sometimes age and gender is a factor, and sometimes it's not. It's just part of the case presentation. So just kind of make a note of it, and see if it helps point you in a direction later on as you analyze the case. So next is going to be the patient's history. You want to note the history. So the history would be any pre-existing condition, usually they're chronic, or lifestyle habits that the patient has and has had prior to the onset of that current medical issue that they're being seen. So the history can include ongoing chronic medical conditions such as chronic infections like Lyme or HIV or hepatitis, chronic conditions such as diabetes, high blood pressure, heart disease, kidney disease, etc., and then habits such as smoking, drinking, drug use, etc. Also being maybe overweight, that can lead into certain conditions too. The history can also include past conditions that have resolved, such as any surgical interventions, a cancer that's in remission, etc. And so the history can help you point to the development of a new condition or disease that is related to an existing one or a lifestyle factor. You just have to, sometimes background is just background, but a lot of times it's not there by accident, and it's listed because it's relevant to the case. So next thing, you want to note the patient's complaints. Their signs and symptoms are often listed, and voice is cracking here. So this is what is bringing the patient to the physician's office or the emergency room, and you can make a distinction sometimes in the case study, they'll make a distinction, but oftentimes it's just you list signs and symptoms together. But for your learning, signs are measurable or observable evidence of disease. So it's something that a health professional can assess and document, regardless of what the patient says. So these are, for example, rashes or redness on the skin, swelling of a limb, vomiting, diarrhea, temperature, as fever, clammy skin, cold sweats. You can usually see that. Blood pressure, elevated or low, heart rate, again, high or low or normal, respiratory rate, oxygen saturation. So these are often lumped in under vital signs and other types of observations. So symptoms are subjective, and they're experienced by the patient and reported by the patient to the healthcare provider, but they can't really check that. They have to just assume that the patient is not lying, that the patient's being truthful about what's going on. So these are things like pain, nausea, headache, fatigue. For example, we do have the pain assessment tool, but again, pain is subjective. It can vary from one person to the next depending on what else is going on with them. And also, honestly, patients lie. So sometimes, they report pain that isn't there just so that it can be seen faster. So next, I want you to think about the signs and symptoms within the case presentation, and are they pointing to a specific organ or organ system that could be affected by the condition or disease. For example, nausea, vomiting, and diarrhea would be associated with the GI system, while a cough and shortness of breath would be associated with the respiratory system. So that's kind of obvious right there. A high or low heart rate could indicate a heart condition, or it could indicate a lack of blood volume or dehydration or something like that. When you're looking at the signs and symptoms, then make a note of all the possible organ systems that could be affected based on the signs and symptoms at presentation. Okay, and then just going to make the note of that and then move on. So next we want to evaluate the testing results. So a lot of times we'll have lab results and imaging results listed. So first you want to compare the patient's values to the reference range and circle or highlight all the abnormal test results. Indicate if they're low or high or positive or negative. And depending on your instructor and your case presentation, you may have to look up the reference range as an exercise as part of the case study. But in real life, your lab results always have the reference range listed on the report. Each lab result can indicate an abnormal function of one or more organ systems. So what you want to do is, as usually case studies are part of learning, you're learning all of this stuff. So you can use testing.com or your lab value reference book or textbook or an app. I like the LabGear app. I have its little icon listed right over here. But testing.com is free. It used to be Lab Test Online. It's a site that's maintained by the AACC. And it's really, really, really good, and it's up-to-date information. And what you can do is look up the test, and then if it'll tell you a lot about the test, patient prep, etc. But if you keep scrolling, it'll give you interpretation of results. To say if this is high, then it can be this list of conditions. If it's low, it can be this list of conditions. And so that's a great source for you to start, figuring out what these test results mean. And then for each test, abnormal test result, I want you to list all the possible interpretations for each high or low result, or positive or negative. Okay. And some of the interpretation with positive and negative are pretty clear cut, but some of the ones with certain enzymes or other values that are high or low could have multiple interpretations. So with the imaging results, you're going to make a note of any relevant medical imaging reports, so the CT reports, X-rays, MRI, etc., and note the organ or organ system affected. Okay, so we've made a bunch of notes of all of this stuff. So then you're going to look at all of it together: case presentation, signs, history, signs, symptoms, etc., the organ systems you thought might be involved with the signs and symptoms, the test and results notes, and what organ systems or diseases these things might be pointing to. And then do you see any emerging themes? Any organ systems involved that it's popping up consistently, diseases that are listed as causes of several of the abnormal results. you're like, oh, it's listed here, 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 and it's in this organ system, so it's starting to make sense. And that's part of what we call the differential diagnosis. So the differential diagnosis is all the possible conditions or diseases that based on the case presentation, so here based on your observations of all the things we've just looked at. So the differential diagnosis is often a study question, not always, but it's like, what are all the possible conditions, or sometimes they'll ask you, what's the differential diagnosis? You're like, what is that? So that's all the possible conditions that fit the presentation in the lab results. Of course, then you have to make a choice between several related conditions or conditions that are similar. And to do that, look at each possibility. So each of the, let's say you have 3 different possibilities in your differential diagnosis, then look at each one and see what are the signs and symptoms and possible relevant history and expected lab results for that condition, for the first condition, then for the second condition, for the third condition, and then see which one fits your case presentation the closest, the best, okay? And then I would say at one point in time you have to decide, so just pick the one that fits the best, and then double check again, make sure that parallel the typical case presentation and lab values of that typical for that diagnosis to your case, and see how they compare and if they're close. So let's address other questions. So often case studies will have then questions that are related to the diagnosis, which is why you want to make sure you get that right first, because if you get that wrong, then you're answering all the other questions based on the wrong diagnosis, and you'll get a lot of that wrong. So once you get the diagnosis, you can use sites like testing.com, but mostly for conditions like Mayo Clinic or textbooks to answer the disease-specific questions. So first, make sure you understand what the question asks. So unfortunately, that happens. I think students assume they know what the question is asking or what certain words mean, and they actually don't have the correct meaning for the words. So I'm going to put some here, and if you ever have any that you're unsure about that pop up in a case study, you can listen below in the comments, and I will give you some guidance when I see it. So etiology means cause. So what's the cause of the disease and condition? So it could be habits. So for example, smoking is causing lung cancer. That would be the etiology of lung cancer could be smoking, but it can also be something else. And it can be genetic or something. So what's the cause of the disease and condition? So that would be what's the etiology. The epidemiology or incidence, so that's usually referring to the population that's affected. So this could be a geographic location. This could be male or female, so this could be gender based. This could be ethnicity based. Some conditions might affect African American more than whites, or some might affect whites more than African American, or might affect indigenous populations more. So that is worth noting. In incidence, usually the number of cases per year. So is this kind of relates to, is this common or is this rare? So those are questions that might be asked. Risk factors. This is one that my students often get wrong. Okay, so risk factors are conditions, lifestyle habits, age, or gender that makes one more likely to get the condition. So for example, with the smoking and stuff, a risk factor of lung cancer is going to be the habit of smoking. Okay, so there you go. And but there's a lot of things there, and so you can find that information once you get the disease or condition you can find that information from Mayo Clinic or other typical websites. I always prefer you stick with .org or .edu websites and stay away from commercial websites. But anyway, so the way my students get this wrong is that they interpret risk factors as complications. They interpret that question as things you are more at risk of getting if you have the condition, and those are complications. So that's the big, usually mix up. So complications are basically how things how they can get worse and go wrong. So this can be a chronic version of the condition. So if you have hepatitis B, acute hepatitis B, you are at risk for getting chronic hep B. If you have hepatitis C, you are at risk for liver cancer, hepatocellular carcinoma, things like that. And then any follow-up tests. So are there any tests that are necessary to confirm the diagnosis or to monitor the condition? And then treatment or prevention, how is the condition treated or how is it prevented? So those are going to be, again, once you get the diagnosis correct, those are pretty self-explanatory, pretty easy to find the information. So then a few things to be mindful of. So as a rule, don't list things such as hyperglycemia, hypernatremia, hypokalemia, etc. as a diagnosis. These are signs or, if you will, the interpretation of lab results. And so you want to find a disease or condition that those signs point to. So if a person has hyperglycemia, for example, it could be diabetes. If they have hyponatremia, it could be dehydration. So don't list a sign as a condition or as a diagnosis. So also I recommend you dig into the pathophysiology of the condition so that you can understand how the disease develops and how it fits with the case presentation and the lab values. That will increase your learning, and then it also reinforces that you picked the right thing, and it can help you answer some of the questions that are asked during case study. So there you go. So I hope you found this helpful and that you can use it and apply it to the case studies that you're given, and that you can solve all the case studies correctly. That would be really great. So if you have any questions, just let me know below in the comments, and I will do my best to answer them.